Good morning. It's Tuesday, September 27th. I'm Jessica Lovell. Thank you so much for joining us here on the Morning Medical Update. If a picture is worth 1,000 words, Tony Gutierrez and his family have said a lot. He spent more than 80 days hospitalized with COVID-19, and his family captured it all. Many finally getting their first round of COVID shots, the impact on a possible winter surge. And speaking of the vaccine, one popular country is now dropping its mandate for COVID shots, the impact it will have on professional sports. Thank you so much for joining us here on Facebook, YouTube, and Twitter this morning. We are live inside the Dulcie Simons Jr. Family Broadcast Studio. Tony Gutierrez joins us virtually this morning along with his wife Candace here with me. Hello, good morning. And in studio with us is critical care medicine specialist Dr. Matt Sharp and respiratory therapist John Sorek, both who helped treat Tony. And we're going to talk with all of you this morning. Gentlemen, how are you today?
Doing great.
Thank you for having us. Good to see you. I'm very excited to share this story, and we thank them both for sharing this with us. And of course, we love getting your questions and getting those answered. So send them in through the links there on your screen, or you can leave them in the chat thread below. With her husband battling COVID in the ICU, Candace Gutierrez used photography as an outlet to express herself, capturing some of her family's most private moments. Tony was hospitalized for 84 days with COVID back in late 2021. And during that time, Candace documented her husband's care and their family's gratitude for his clinicians and the close bonds they developed. Candace, good morning to you. Tony, hello. Candace, I want to start with you. This must have been tough to be there at the bedside, seeing Tony in this condition, but how did documenting all of this help you cope?
I don't know. It was so tough. I don't know if I did set out necessarily to know that that's what I was doing to cope. I just sat there and I think I had no words to describe the situation that we were in, the nightmare that it felt like we were living. And so I just started taking photos because the care that he was given, the people that would come into the room, everybody was just, I just was so thankful and grateful for every moment that he was alive. And so I just started documenting, thinking one day I'm going to sit here and share this with him.
It sounds like the pictures said what you couldn't say. Is that somewhat accurate, Candace?
Exactly.
Tony, how are you today?
You know, I always like my first line I always like to say is I'm alive. And so I'm so thankful to be here. I am, recovering. It's been a year of recovery, but my lungs are healed, my liver's healed. I'm alive and well. I deal with some lingering pain, nerve pain or muscle pain, but other than that, I'm very thankful to be here and alive today.
Well, we were speaking, you and I asked you about those lingering symptoms because you think, gosh, somebody's been in the hospital with COVID for over 80 days. They're going to have something to take home with them. And your first thing was, yes, I'm alive. Those lingering symptoms, even as slight as they are, mean nothing to the fact that you're still here with your family, right?
Yes, that's what I wanted. I was like, you can ask all the doctors. That's what I kept saying. I just got to get home. I got to get home.
Got to get home. What do you remember most about your time? I'm sure it was interesting to go back and see the photos that your wife had taken, but what do you remember on those times that you were awake and?
Yeah, it was a scary thing. For me, I guess I just remember the most, just the care that I received. I always like to say it wasn't just care for me, but care for my family. When I woke up, the nurses, the doctors, my children, they felt comfortable, they felt safe, they felt like people were there on their side. And so just, people would come in and visit me that weren't even my doctors because they just wanted to come in and see what was going on and check on us because they heard the story. And so to me, that's what I remember. I remember kind of felt like a family atmosphere, like people were rooting for us, we're there, and I remember that the most.
Yeah, you said the word family, And I think that, and we've got part of your family right here, John Sorick, who was your respiratory therapist, and Dr. Sharp, who's with us. They remember you, you remember them, and it is, I mean, during this really, really rough time, gentlemen, I'm sure it's the same thing. You become family, right?
Absolutely.
Right, John? I know.
To see him up like this does my heart so good.
Yeah.
Are you
It's
cheering
amazing.
up on me?
Oh, of
amazing.
course. You
John,
know it.
John, it's every time. I love it.
It's an early morning. I'm sorry.
It's this
I haven't
man.
seen him in so long.
But we look at those pictures, though, guys. Let's look at those pictures, because you see that, and then you see this smiling guy standing here and sitting here visiting with us today. It is emotional. There's no doubt about it. Dr. Sharp, when we see these photos, we see wires and just dozens of machines hooked up to Tony. Just tell us about the intense care that he was receiving back then. How sick was he?
Yeah, thank you. And again, it is so great to see you guys today. Thank you for joining us. But you know, Tony was incredibly ill, as critically ill as a person can be and still be alive. And his illness progressed very quickly from when he was admitted to the hospital. His lungs started to kind of shut down, not work. He had to go on a life support machine. His kidneys failed, liver injury, everything associated with his COVID infection. And he faced a long and tough battle. And with the support of his family and everything, and all the doctors and nurses who worked tirelessly around him, was able to ultimately pull through. So he was very sick, but made it through. And the photographs are amazing, just amazing, Candace.
Candace, thank you for sharing these. Again, just putting into words what we couldn't see, and you take us right into that room. And again, emotional for you, and I know emotional for your care team as well. I want to talk about, though, you mentioned how sick he was. He was so sick as you can be without dying. Did he qualify for ECMO?
Yeah, so that's a great question, and let's define what ECMO is for the audience. So ECMO is a procedure essentially where a person is hooked up to a machine when their lungs are not able to adequately oxygenate the body or clear the carbon dioxide from the body that we have to be able to clear. Also, in some patients, if their heart function is so damaged that they cannot functionally pump the blood around the body, those people oftentimes will be considered for ECMO. Thankfully, we did not get to that point in regards to Tony. We thought early on that we might. We actually discussed ECMO with our cardiothoracic surgeons and anesthesiologists who are part of that if that procedure is needed. But we were ultimately able, even with chest tubes, to reinflate Tony's lungs, mechanical ventilation, life support. We were able to adequately oxygenate him throughout these 84 days. And his heart, although he was at times suffering from low blood pressure and shock, we were able to kind of maintain him throughout this and get him through without having to resort to ECMO.
So ECMO is truly the last line of defense?
It is the last line of defense, and there are clearly, with anything that we do, always issues that may arise just from an ECMO procedure. And so if we don't have to go to that, we try not to, but we were ready to if we needed to. And so that's kind of where it landed with Tony.
John, breathing, it's just the most natural of functions our body does. You sit at the bedside and you are there to help people perform that function and get them back to life. What was it like treating Tony? What do you remember from that care?
Oh, man. We have to remember we're a year and a half into COVID. It feels like the nightmare that won't end for all of us. And to have someone's family like Tony's come in, and the grace and the appreciation and the care just helps revitalize our team. It's what we needed being that far into the trenches. It's what we needed as that little breath. Like we talked about before, we had patients photographed before, but never to the caliber and the quality that Candace had. And really to able to capture these moments was just phenomenal.
Rough to see, but they're beautiful in some ways.
Yeah.
And to see the family there, and to see the photos that Candace caught with you all, who are going to now just be forever family, whether you like it or not. You're going to be forever family, a forever part of the scrapbook and photo albums. So I want to talk, John, a little bit about what you do as a respiratory therapist, and I think we have some video of you at the bedside, not with Tony, but we have some video of you proning. I mean, these were some of your rough, tough days in
Yeah.
the trenches of COVID. Just explain to people what you are doing.
So a lot of times, kind of what Dr. Sharp was referring to, when the lungs won't function, we have different fields of the lung. And when we're able to turn a patient over, like when we put them in a prone position, we're utilizing the back function of the lungs instead of the front top function that we normally utilize. So when we're able to flip somebody over on prone, they are literally just that. They're laying on their stomach. So you have all the tubes, you have all the life-saving medicine, chest tubes, every line that we need to keep Tony alive or to keep a patient alive at that time, we are navigating while we're turning those patients over.
So we see all of these tubes, but you're actually using the person's body for these kind of pulling out the stops,
Yeah,
using their own body weight and the
absolutely.
positioning of the body. Also somewhat of a last line of defense,
Absolutely,
true?
absolutely. It's a technique that's been around for a long time. It's a technique that kind of fell out of favor because of, is it mortality, is it worth it, beneficial?
But during that pandemic, it was worth it.
Yeah, when we were pushed up against the wall with COVID, we had nothing else to
So
try.
you didn't think you'd be doing that several times a day
Oh, the way
over a year and a half.
Yeah, multiple times a day.
How are you doing, by the way? I know this has been taking a toll on you over the year and a half.
I've recently switched jobs.
Mm-hmm.
I'm out of the bedside. I'm more into the OR and work more on the supply chain side.
Mm-hmm.
So I'm now a value analyst as well as a respiratory therapist. So I help utilize new products that come into the health system and help out our doctors more with what they need so we can get our patients what they need.
In a different way.
In a different way.
And I mean, if people haven't seen John on our show before, I mean, you heard truly, I mean, the most frontline staff we have had. And we appreciate all you have done. And you've seen it all and been there, done that. So we appreciate that. And Candace, I want to get back with you and ask you, there you guys are. I'm sorry. I love seeing these pictures in the bed and then standing
love 'em.
upright. I love those memories. Candace, how's the family doing? How's your family doing? And how are you coping and how are you moving on with life?
We're doing really well. I think we are at a place where we're just very grateful, very thankful in the midst of some of those darkest moments. We look back on them and we see a lot of light. We see love. We see when we feel alone, we had people together. We were, we smiled in those times. And so as we move forward, we just have a lot of hope and we tell people our story and we're like, no matter how dark it is, like, don't give up. And so that's kind of been the last year as we've been walking through healing is just, we would never wish to be in that kind of situation, but in the middle of it, there was just so much love, so much grace, so much just light poured out to our family. And so just very, very, very thankful.
Tony, I want to ask you about something. You were not vaccinated at the time that you got infected with COVID, but you are now. Tell us about those two decisions.
Well, I think at the time, I wasn't against it. I just honestly had a lot of questions. It was so new. It wasn't FDA approved. And so I just had a lot of questions. Didn't know which one to get, didn't know. And so obviously I got sick. And so I am vaccinated now. And so, I don't think we were ever against it. Just was really unsure. It was so new and so much going on that it was hard to navigate all of that. That's how I felt about the situation.
Well, and fair enough. We've had people say that, they needed to get answers, Dr. Sharp. I mean, this is a very confusing time for people.
Right.
And making that decision, COVID got him before he was able to get those answers. But my question is, how did COVID affect your patient care? Dr. Sharp, tell us a little bit about that. That's what you do.
Right.
And this is attacking your patients in the most direct way.
Yeah.
Talk to us about that.
Yeah, exactly. I think probably the biggest difference, because we take care of people on a daily basis that are critically ill for different reasons. The big difference with COVID was just the sheer volume of patients that we were required to take care of. And from our perspective, it felt like any given day when we're taking care of somebody on multiple life support machines and different things like that. But it really was an incredible team effort that I would suggest in regards to just every person that was involved in the care of a patient that was in our ICU or in the hospital with COVID. It was dramatic, from respiratory therapy to pharmacy to nursing to food service to whatever that would have looked like. And everybody at that time over that year and a half was very stressed, but everybody came together and nobody ever really complained about anything. And as it's always been at this hospital, and I've been here for a long time, the focus never veered from doing what was best for the patient. And that was always our focus. And we love to, have involvement with Candace and her family. And we'd love to have them there when they were finally able to be in the hospital with Tony. And it was a real win. And like John said, it was so important that we had victories like that throughout this time frame. It was amazing, and it just made all the difference in the world. And so it was the support that was given back to all of those people that were in this and taking care of people that were in Tony's position. So I think that was probably the biggest difference in regards to what I do. And it's just one of those things that just makes you push on every day and say, absolutely everything that we do here is worth it, and this is why.
I love what you say. Yeah, you had so many stories that didn't turn out
absolutely
the way Tony's did. So that one story is what kept you going and fighting, just like the patients were. Tony, you're a pastor at Awaken Church, Kansas City.
Yeah.
What role did the power of prayer play for you and your support group?
Oh man, I believe that prayer was just our hope. And it brought hope to so many. I had people praying all over the world. I had people tell me that say, I don't normally pray and I'm praying now. And so I feel like that was just a hope, and you felt that hope in the room. You felt that light in the room, that we weren't alone. And so I feel like it was a way that people were able to be with us without actually being up there with us. And like I said, I just feel like it brought a new hope that I would get that when I remember people saying that all the time. Like, I'm just in this room and I just feel a hope. I just need to come in here and read a sign that's on the wall because I need this hope. And I believe that prayer meant so much. And it's wild that our church is planted right down the street from KU, so we were right there. So there was many prayer meetings, many things going on, but people were praying all over the world for me, and I believe it made all the difference.
Yeah, you could feel it right down the road. Okay. I love a good full circle moment, and this like embodies it for sure. Okay, so Tony, you officiated the wedding for one of the nurses who cared for you, Nurse Bethan. I remember Bethan telling me that she had met her now husband up on the floors. Didn't she? Yeah. Isn't that right, John?
Yeah, he used to be a respiratory therapist.
Yeah, they were both respiratory therapists and nurse up on the floor together. So they met each other behind masks during a pandemic. Then you come into the picture. And now you are here officiating their wedding. How significant, when you see these pictures, is that for your healing? I mean, this really just puts a stamp on this happy ending.
It did, and I was so honored to do it. When you're in the hospital and you're talking, and I remember, I feel like it was a stride for me. I was like, I'm going to get out here and I'll do your guys' wedding. So it was something that it's like I got to walk again. I got to do these things because I got to get out there and be able to do this wedding for this young couple that were amazing. I mean, what they did and the care that they gave me, the relationship that we were able to build with them, just meant the world. And so to me, it felt like I said, it was a goal. Like, I got to be walking and standing and be able to do this. And it was the first wedding that I officiated after being sick. And so it was an honor to do. I was so excited to do it.
Yeah, you said you were in, and you were in. You had a goal to reach. And it's such a cool story.
Yeah.
I love that. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count and some COVID headlines this morning. Good morning to you.
Yeah, hi.
Hi.
Always these great stories.
Aren't they?
Yeah. So very happy for his family and him for sure. Right now in the hospital, we have 32 active infections with 3 in the ICU, still 1 on the ventilator, and 25 in that recovery period as well. So still hanging out in those low 30s for active infections. Again, overall, we do know currently, and it has been for several weeks, amount of reported cases and hospitalizations have gone down both nationally and in our region as well, according to the MARC dashboard. So,
Dr. Hawkinson, some people in the U.S. are getting their very first round of COVID vaccines almost 2 years after it became available. What impact could those new people coming on board and getting vaccinated, could that have an impact this winter if we have a surge?
I think it certainly can. We know that although we've heard stories about the Omicron variant being less severe, again, that's compared to Delta, which seemed to have a higher risk of hospitalization compared to the other variants. But we know basically all of these variants can really or carry the same risk. So I think when we're talking about people are getting their first vaccine, we also have to ask, well, have you been infected before? And if you've had an infection, if you're getting your first doses of vaccine, that's going to be essentially those 3 exposures to spike. That is what we have found really offers that best chance at immune response to create those B cells that make those antibodies and also those T cells. But again, we'll continue to endorse, and I think that's great if you haven't been vaccinated. We know that vaccine helps reduce your risk of hospitalization and severe disease and death. Also those other complications such as the blood clots and even long COVID. So I think it's important, and we're happy to give it, and more people that can get vaccinated, the better. We know overall vaccine reduces your risk of those complications.
CDC says universal masking can be dropped in some nursing homes and hospitals. Any concerns on your end?
Yeah, I mean, first, let's be clear. They are using, for community issues like dropping mask mandates, there's a different metric used than what we use in the healthcare setting. And right now, less than a quarter of healthcare settings around the nation would really fall under that risk transmission to be able to drop that mask mandate. Certainly, it's a concern in the future, but right now, the vast majority of healthcare settings around the nation do not qualify to be able to do that. I think it is one step closer to being in those pre-pandemic eras when we wouldn't have to wear masks, but we need to do it safely, and I think we need to have those types of conversations. But right now, looking at community transmission, and that is really what is used in the healthcare setting for making decisions for things such as visitation, masking, all of those other issues. Again, the vast majority of healthcare settings in America would not fall under that. So right now, I don't think that's a big issue, but certainly moving forward, I think we can have those conversations, but just make sure that we're doing it in a thoughtful manner and understanding all of the risks. And number one, keeping the safety of our patients in the utmost priority.
Dr. Hawkinson, thanks so much.
Yeah.
Let's check and see if we have any reporters on the line. We are good to go. Let's get to the community. So if we could grab the proning video. Joellen has a question for John. When a COVID patient is prone, I would imagine the caregivers or the family, if they were allowed at that point to be in the hospital, we know at that time many were not, could you kind of go through that again? She says she just imagines this to be a very scary time. What is the state of, if a family were to be there, would they ever see that happen? And I remember seeing this for the first time, John, and our team, and again, we were seeing images that had never been seen before because we just would never have a reason to be up there with you all, but you kind of took us behind the curtain, if you will, and it was really jarring and very shocking to see this happen. Talk us through it a little bit more, if you would.
It's jarring for the people who watch, and it's jarring for us who do it. Knowing that if we do make a slip and you lose that line that's giving you your antihypertensive, or it's giving you your blood pressure medication, or it's giving you your dialysis, those are life-saving lines, or your chest tube, like in Tony's situation. It's very important, and it's a dance. It is a very much a choreographed dance of left foot, right foot, and let's not step on anybody's toes, where everybody moves together in one sweeping fashion to get the patient over onto their stomach. We would put them onto their stomach, prone position, for 16 hours, and we do what's called swimming to help keep any skin from breaking down. So we move the arms just in a swimming form, and you move the legs a little bit. You're making sure that you aren't just laying in one position that might cause skin breakdown or any type of increased damage.
A dance where everyone is trying to do their job precisely.
Absolutely.
And right. That's a really good way of describing it. Karen wants to know, Dr. Sharp, will Tony have any long-term issues? What will his long-term care be as far as checking up with you? I talked to him and he said relatively Doing great.
Right.
No complaints, I don't think, on his end. But realistically, for patients who've been in that long, what might we see?
Sure, yeah. So that's a great question, and really the best answer I can give is we're still learning a lot about that. But what we have seen in a lot of our patients, whether you define it as long COVID or long hauler type COVID syndrome, some patients will experience a lot of fatigue. In Tony's respect, thankfully his lungs have improved dramatically, but some patients may not be so lucky, and they may develop scarring of their lung, and so that may be a situation where persistent shortness of breath, persistent weakness, and things like that may be more of a long-term illness type scenario for them, and we will continue to follow them in clinic.
But that wouldn't necessarily be, would that be considered long haul COVID, what we've talked about as long haul, or is that long-term symptoms from being in the hospital under this type of intense care?
Well,
are those two different things, or are they the same?
Actually, they kind of cross over
Okay.
a little bit in regards to the fact that a lot of the damage is clearly done when he is infected with COVID.
Got it.
Some of those symptoms, though, we see in patients that may come into the hospital and have a positive COVID test, but clearly do not become as ill as Tony, but still kind of have these persistent type symptoms that can last for quite some time. And everybody's different. And so as we continue to learn more about that, I think we'll know, but we don't yet.
Yeah, but we don't. Still
Yeah.
learning, 2.5 years in.
Right.
Yen Liang has a question for Candace. Talk to me about, asking about how did you talk with Tony? What were those conversations like? Were you, was he able to respond to you in certain ways? How were you communicating even when he couldn't speak back?
So at first he couldn't, he was just in a coma and was just laying there. But I kind of just always talked to him like as if he could respond back to me. I would tell him about our morning and how the kids were doing, and just like as if he was listening on the other end. As he started to wake up some, we didn't know the intensity of what his brain function would be like. And so I would just tell him little things that were between us, and I could see his eyes, like he would make connections with me that I knew that he knew what I was saying. It was a very slow process. He had to relearn to talk and to walk and to feed himself and to, so I think each moment looked really different for us.
Yeah.
It was a slow process over a very, very long period of time. Sharon has a comment, and then I'd love both of you to comment as well. But she said, when I was in the hospital back in 2020, that was the time when no one was allowed to be in with me. And it was just a really scary time. What was it like to see patients in there? And I know you were the communicator, you're the liaison between the families. I mean, we were doing this by, iPads, and patients couldn't hear, but the families needed to have some connection with them. Just what do you remember from those days when families weren't able to get in and patients were alone and you were the family?
Yeah, that was the hardest part, being the one at the bedside, holding their hands through these situations, and someone who they didn't know, someone who you're not in the right state of mind, and we don't really expect you to be your best. You have a lot going on. You don't understand what's going on with your body. It is an unfair situation. It is an uncomfortable situation, and we have to be that family. And that's the other part of caregiving, where yes, we have our physical job, but you have the emotional job. We are tied. Tony and I are tied. He knows that. We're tied.
Yes, you are. Yes,
and
you are.
Just being there and taking on that situation is something that a lot of people might overlook as a caregiver, is that emotional debt, the payment you have to give, where we're propping up the iPad and trying to answer the questions for the family while they're there. So.
Yeah, that's tough. And do the job and keep the patient alive. Well, is there physical therapy, Kathy wants to know, for patients like this? Do they ever have to go, we kind of goes back to the post-care, but physical therapy, again, I know. We got some the heads nodding. What did you have to go through, Tony?
Oh, I spent 84 days total, but that was between 3 hospitals. So I went from ICU and critical care, KU, to LTAC Center, back to acute rehab. And so, and even when I got out of the hospital, I had to 8 weeks of it, 3 times a week. Yeah. And so it was it was a process. I mean, in all things, like I said, I dealt with a lot of body pain, a lot of nerve pain, going, like I said, visiting the doctors, follow-up visits. There was a whole lot. I mean, there was at one point where I thought maybe I would never walk again. And so, because I just had no strength in my legs to stand. And I can, it was a process every day. Like I said, it's different from the movies. You don't wake up and you're just ready to go. Like it's a full process of healing and emotional, physical. It's been a long year, but I just try to have gratitude of hey, I am alive and thankful to be here.
Yeah, we see those pictures of you, I think, and John standing there, and you're right. Getting out of that bed right there is just part of the story, and then starts the next phase of recovery. So I think you answered that question really well. Yes, it isn't you jump out of bed one day and you're off and on your way,
Can I
right?
comment on
Absolutely,
that just briefly?
please.
Thank you, Jess. So it's interesting because we actually, and I don't know if there's photos today of this, but we try and get patients moving in the ICU as quickly as we can. So I remember specifically Tony's still on a ventilator, whether it was through a trach or breathing machine, and physical therapy would come in on a daily basis and sit him up on the edge of the bed, clearly with lots of support. But that movement and that physical therapy component of that starts very early in a person's ICU stay, because we recognize that will only benefit them long term, and so that was done with Tony as well.
That's something that I'm learning that for sure. That's the physical therapy starts before they even get to physical therapy.
Absolutely.
And it probably makes that part of the journey much easier. Just starting you on your way. Question from one of our viewers, Tony, is: do you remember what type of symptoms you had with COVID? I mean, go back to the beginning of this. This all started with COVID. What symptoms do you remember having, and how did you know it was time to go?
I had a headache, really, is what it was, and I was just had a headache and started not feeling well, and body aches, and so I remember feeling like, oh, something's wrong. Maybe I'm just tired, and finally I went to the I went to the urgent care. And they were like, let's test you. And they said,
you were sweating.
I was breaking a fever, had a fever. And so went to the urgent care, and they said, you do have COVID, but we're going to do an x-ray of your lungs, and your lungs are clear. And so they said, let's just have you rest, take some Tylenol, ibuprofen, and rest. That was all. That was what they recommended. And then as just time went on, it kept getting worse. My breathing was getting harder to breathe. I had a really bad cough, and even when I went into the ER, they told me, hey, you're only going to be here a few days. We just need to monitor you, get your oxygen levels up. And all I kept saying was, I don't want to go on a ventilator. And it just, 2 days turned into 6 days, turned into being put on the ventilator, and to 84 days. So it was a process, and I really thought, I was just unsure, and it was, I'm thankful for the care that I received.
We know you are. And I have to say, Tony, it's been a minute since we've had a patient on our show that's gone through COVID, and certainly in the capacity that you did. And I think we do it today to remind people that COVID is still here. And I know that you don't want somebody to have to go through what you're going through. We want people to be vaccinated and boosted and stay up on those things. And that people are still having people maybe who didn't stay in ICU as long as he did, but are having long term. I mean, we know we've talked to patients who've had to quit their jobs, or who just completely have no ability to function in life, and their quality of life is down. So, we do this story to share that it's still here, and our numbers are still here, and people are still dying from COVID. My final question to you, and then we're going to get to some final thoughts, is what was it like when you were able to look at the photos that your wife, Tony, had taken, and to see yourself in that state? What was that like to say, wow, that was me lying in that bed?
Sometimes it seems so surreal. I look at those photos. It took me a while to be able to look at those photos. I think in the midst of going through, everything I was going through, it was just hard to watch and hard to see. For me, I think the photos really just caught, what she was seeing, what my family was seeing. I can't imagine what they were thinking as they were watching me lay there, and being, lifeless basically. And so those photos, now I can look back and I just, I tear up. I'm thankful. I smile. Sometimes I got to be reminded that, hey, I've come so far. Because, like I said, it's a process. It's a mental process. It's a physical process. And seeing those photos and just seeing, like I said, it breaks my heart for what my family and what those had to see. But I'm thankful for the outcome, and thankful that we have that to look back at. It's a true testimony of, like I said, just the hope that was there, and it's a testimony of the family that was there. It's a testimony of the care, the doctors, the nurses, and God's favor on my life. So it was just a good thing.
Well, we're thankful that you're here and that you both are sharing your story, and we can feel the love right through that screen and the support. Awesome. It's fantastic.
So awesome.
I'm going to start in studio with our final thoughts. John, just, again, what's it like to be here on the other side of a good story like this?
It's awesome. It does the soul so good. I'm just so happy to be here and be able to share this moment with you guys. And I appreciate it.
I'm glad you're doing well.
I am.
Always good to
really
see you
am.
smile and cry.
Tears.
I
joy.
love your
They're
tears.
joys.
Your tears
They're
of joy
joy.
warm my heart. I love it. All right, Dr. Sharp, final thoughts from you today. What do you want us to know?
I just mainly want to say thank you to the Gutierrez family. It's been a tough couple years for everyone involved. At a time when we needed it, you guys provided as much to us as everybody involved as we hope that we were able to provide to you. So thank you for inviting me to be a part of this. It is just so uplifting, and it just it makes you realize that we do what we do for this reason, and we really appreciate everything that you guys have done for us.
Well, thank you. Thanks for letting me sit in on this reunion. I love this happy reunion.
Thanks for having us.
Let's get to both of you, Candace and Tony, just your final thoughts. Just kind of what do you want to leave us with today?
Yeah.
Thank you. I just wanted to say one comment that when I wasn't able to be up there for a couple of weeks with him when he was first sick and watching through the iPad, and I remember walking through the door in that first moment of seeing him in the bed, and I looked around and I thought, wow, you're being taken care of. Your room, the way that he's groomed, and just like everything about him, I just knew from that moment that the whole time when I wasn't with him that Unit 61 was just took such great care of him. And so Unit 61, I just wanted to tell you, thank you. Like, I get so emotional, but you fought for us. You fought with us. You made all the difference.
Yeah.
We love you guys.
Yeah. And I always just like to say, Unit 61, the doctors, the care, everything, it didn't just save my life, it saved my family's life. And so, I'm so thankful that, I had that care, even, I just felt safe. I felt, like it was going to be okay in the midst of uncertainty. And like I said, I felt safe. My family felt safe. My wife felt safe. And so many unknowns. And so I am so thankful to every doctor, to the nurse, to the respiratory, to, John. I remember John, he gave me my first bite of sherbet. It was great. Every time. And to OT and PT and
RT.
Yes, every the people that cleaned our room, that they would come in and just want to see how we were doing. And it just, I love that family atmosphere. That's what we're about. And so it was just a light to our family, to so many people, and a testimony. We tell everybody, KU, that's where you need to go. The best hospital, they'll take care of you there. And
Kara.
so, yeah, like so many, my nurses, all of them. I love them all. And so we're friends. A lot of us are friends on Facebook now. And so it's great connecting and keeping up to date. But I'm so thankful that my story can help and we can be a light, and in the darkest time can be a testimony of just goodness. And so we're thankful.
Well, we are thankful. Thank you for sharing the story. Thank you for being you. Come back and see us anytime. John will feed you sherbet anytime, any day. You name the time. Thank you both. Just please be
Thank
well
you.
and stay in touch with us.
Thank you so much,
Thank you,
guys.
Jess.
Thank you.
Thanks, guys.
Dr. Hawkinson, what
Yeah,
you got?
Just, just grateful that John could be back with his family. Such a good story in a time when we know there were so many tragedies and so many tragedies that continue to happen, unfortunately. Again, still best practice, remember to be up to date with your vaccine to help reduce any of that risk of going to the hospital and suffering what he had suffered. Also testing early, and if you do meet that criteria, get on Paxlovid, all of these things to help keep you out and to keep you from those situations. And again, just a big thank you also to all of our nursing assistants and our nurses, and of course our respiratory therapists and our physicians, everybody that we have here to take care of you and help you get better and get back home to your family as soon as possible.
Yeah, great shout out to Unit 61. All right, pro athletes will no longer need to be vaccinated to play in Canada. That is starting October 1st. Removal of the vaccine mandate means that unvaccinated Major League Baseball players would be allowed to play in Toronto if the playoffs should be the Blue Jays making it to the postseason. It would also apply to the NBA and the NHL. Canada also has announced it will no longer require people to wear masks on airplanes to help guard against COVID-19. Both Pfizer and Moderna have asked the FDA to approve their updated coronavirus boosters for children. The bivalent shot, now available for adults, target both the original coronavirus and the Omicron BA4 and BA5 variants. Pfizer hopes to get the shot to kids ages 5 to 11, while Moderna's shot hopes to get to kids ages 6 to 11. Pfizer is also testing its vaccine on children ages 6 months to 5 years old and hope to have those results here pretty soon. And Doc Hawk says it. He's been pushing for it. Researchers at the Mainline Health say you need to get both your booster and flu shots this year, and you can get them at the same time. They say the main reason is that Australia is experiencing its worst flu season in 5 years. Possibly foreshadowing of what might come here to the U.S. We don't know, but the flu shot decreases your chances of severe disease. When it comes to the COVID vaccine, 68 million Americans still remain not completely vaccinated. Coming up tomorrow on Open Mics with Dr. Stites, we'll talk about vaccines. People either love them or hate them, but there's no question they've made a difference in this pandemic. We're going to stick to the science as we welcome back Dr. Greg Pullen, head of Mayo Clinic's Vaccine Research Department. We'll look at where we are with vaccines and where we are headed in the fight against COVID-19. We'll see you back here tomorrow at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.